Hi everyone, this is Mr. Neil Wrighter, also known as the Wax Whisperer. Thank you for tuning in to my latest video. So I have a patient who attended with a fully blocked right ear. It's a regular patient of mine who attends annually. Now, a bit of a back history of the client. The client, due to their very narrow ear canal entrance, as you can see here, which is virtually shut, has a chronic wax buildup and has had chronic wax buildup for many, many years now. And previously, we're talking a couple of decades ago, they used to have their ears washed out, irrigated, or syringed back then actually, at primary care services by their local nurse and doctor. However, because of the shape and the narrowness of the ear, they used to struggle to get all the wax out. Also, the patient used to develop chronic ear infections as a result of having water flushed into their ear. So in the last decade or so, they would have their ears microsuctioned. However, I'd say, I think 3 or 4 years ago, the patient had microsuction performed, which caused quite severe tinnitus. And the tinnitus did improve significantly after the procedure. However, whenever they had repeat microsuction performed, the tinnitus would be exacerbated for a few weeks, and is very anxious. Is always concerned that there might be an occasion where it never does resolve itself. So the patient visits me now just purely to see if we can remove this using what I call mechanical instruments. And mechanical instruments are what we're using right now: Jobson horn, an ear hook, or crocodile forceps. So there's no noise involved. So why do people sometimes, rarely, I should add, suffer from tinnitus post-microsuction? Now, microsuction can be quite noisy. Loud sounds are a well-known trigger for tinnitus. I'm a bit older now, but in my younger days, I used to visit loud, noisy bars and pubs with loud music, concerts. Quite often, for a couple of days afterwards, I would suffer from tinnitus. And also a temporary threshold shift, which is a temporary reduction in your hearing. It typically lasts 24, 48 hours. And the reason for that is when you're exposed to loud sounds, your ear takes a battering. So you have what we call outer and inner hair cells. These are your sensory hair cells in the organ of hearing called the cochlea. And so when sounds enter the ear, they travel through the ear canal, they hit the eardrum, and the eardrum vibrates. These vibrations are transmitted to the 3 middle ear bones, the hammer, anvil, and stirrup. The stirrup bone is connected to the cochlea, which is the organ of hearing, and when that stirrup bone vibrates, it causes fluid in the cochlea to travel in waves. These waves of fluid travel over these hair cells, causing them to shear to one side, so they move to one side. When they shear to one side, they allow potassium to enter the cell, the hair cell. The hair cell then contracts, and that contraction causes a displacement of another membrane, which then produces an electrical signal which is sent to the brain via the hearing nerve. So that's, you can see it's a very intricate system, and that's very, in layman terms, it's a lot more intricate than that. So they say sounds above 85 decibels can cause some damage, temporary damage to the hair cells themselves. They distort, their physical structures changed, and when you're exposed to loud sounds, whether it's a very, very loud sound but a very brief moment of time, or a moderately loud sound, so I would say 85 decibels and above, for continuously over a period of time, you have a buildup of unwanted chemicals, toxins in the ear, in the hair cells, and we want the ear to flush this out, and your ear also needs time. Those hair cells need time to recover. It's just like anything. If you're exercising, you have a big session at the gym, your body needs time to recuperate, and during this time you can get a buildup of lactic acid in your legs, muscles, causes pain, and it's similar to the ear. And so during that time, we can experience a temporary threshold shift and also tinnitus. Therefore, microsuction is quite noisy. At its peak, it can be up to 120 decibels, which is very, very noisy. And therefore, it can cause a possible temporary threshold shift, and also either the onset of tinnitus or exacerbation of pre-existing tinnitus. Now, that's very, very rare. I must stress that to you guys. It's very rare. I don't think there's very clear data, but anecdotally at least, assume that you're more likely to develop tinnitus from irrigation. Now, you can see here, I'll just come back to the procedure, just using a Jobson horn, and it's just this part, I wasn't able to remove this using a Jobson horn. It's just the angle in the ear, it was a bit more stubborn. So what I've done, I've very, very quickly entered the ear with a fine end gauge. So this is a fine end gauge, so it's much, much quieter than traditional microsuction. So a traditional Zollner suction probe, the internal diameter, I think it's about 1.8 millimeters or 1.7. This fine end, we attach it to the end of a Zollner suction probe, and it reduces the diameter of the suction probe significantly to like 1.2, I believe. There's a lot, obviously it's almost half the diameter, half the surface area, so it's a lot quieter. So I just use it for that one little bit, and I explain to the patient, we've got no choice here. I have to resort to this just for this bit, because of the angle, the Jobson horn. Let's see, it's a straight angle Jobson horn. It's very hard to get around bends. That's something that I'm thinking of improving the design on. So I must stress that to you guys. So don't be put off by the idea of how microsuction performed. Yes, it is a possible side effect. We have to explain that to everyone. But it's very rare, and as I said, you're more likely, anecdotally from what I gauge and from what patients I've seen who've had irrigation performed in the past. And I think there is some a bit more empirical evidence available, but I think there needs to be a bigger study and looking into it all. But yeah, it's a very, very low risk. Every procedure has possible side effects, but in this case, because the patient's anxiety was so high, and they're worried from the first instance, it's what the irrigation in the first place caused the tinnitus. So wherever possible, we do try and remove as much wax as we can. It's not always possible, and then you have to let the patient know that you've got a choice. There's a bit of wax remaining in the ear. Either we leave it in there, but you may struggle to hear, or we just use suction very quickly. There are some other techniques. You can use suction holes with a fenestration hole, which it's like a hole where the handle is, and it means it's less suction power, so it's less noisy. You can use a fine end gauge like I did. You can also reduce the power of the suction machine, so it's less noise. When the wax is quite deep, so when it's in the inner 2/3 of the ear canal, it's always much more difficult to use Jobson horns and ear hooks, because you're most likely going to become in contact with the bony part of the ear canal, which is very sensitive. So we're just on the border of the cartilaginous, osteocartilaginous portion here. If I put this much pressure on the bony part of the ear canal, it'll be very, very uncomfortable for the patient. A patient would flinch, it'd be very sensitive. So we are also sometimes limited to using these instrumentations on the outer third, the cartilaginous portion, which is less sensitive. But you can see there, lovely healthy eardrum. There's a bit of residual wax around the edge. We're not overly concerned, but I do think I try and mop as much as I can on the cartilaginous portion. So this is on the cartilaginous portion. And I know we're kind of on the cartilaginous portions. I can just see a few hair strands there. Hair strands are only present on the cartilaginous portion, but we're happy with that. That's all the contents from one ear. It's a big hole. So yeah, quite a complex procedure, not only because of the patient's ear canal's completely narrow, slit, almost shut at the entrance, but also because we had to remove as much wax as possible just using a Jobson horn. I hope you enjoyed that video, guys. Take care, keep well, speak to you soon.